Excellencies, honorable guests, distinguished delegates, and dear friends, kia ora koutou, and warm greetings. It is an honor to join you at the International Conference on Urban Health here in Wellington. I want to begin by thanking ICUH for bringing us together once again. At UN Habitat, we are proud to co-sponsor this important gathering. This year's theme could not be more urgent. Pacific Islands contributes less than 0.03% of global emissions, yet they are among the most affected. Sea level rise, stronger cyclones, and shifting rainfall are displacing communities and straining health systems. Already, we are seeing increased cases of malaria and dengue fever in the islands. Across the Pacific and Asia, the front line of this climate health crisis is urban. And it is not just the big capitals that matter. Half of all urban households live in cities with fewer than 500,000 inhabitants. Their transition will be critical for building resilience. At the same time, while the share of people living in slums has declined, over 500 million still live in slums in Asia Pacific. This is 100 times the population of New Zealand. Today, over 60% of critical health facilities in Pacific Island countries are within 500 meters of the coast, placing essential services at direct risk. When these facilities fail, the human cost is profound. But resilience does not begin in hospitals, it begins at home. Housing is not a luxury, it is preventive medicine. A resilient housing with ventilation, clean water, and sanitation protects health as much as any hospital. And urban environments with shade, walkability, and gathering spaces are more than good design. They are preventive health care. Urban planning and public health are historically closely related to promote healthy and safe urban environment through efforts such as development of water and waste management, green public spaces, and curbing congestion. In the Pacific Seas, the safe and clean water, as well as sewage and solid waste management, remain as outstanding challenges in terms of healthy urban environment. But homes and urban environments alone are not enough. Communities are not just beneficiaries, they are authors of resilience. Women's groups, youth networks, and elders' councils know what must be protected. Indigenous perspectives remind us that land is king, housing is belonging, and health is collective. And at the center of it all is equity. Those who contributed least to climate change face the greatest harm. Climate equity means fair financing, fair policies, and decision-making power for those most affected. So the task ahead is collaboration. Urban planning, health, climate action, and community leadership must move together. Let us strive to commit to one concrete action during this conference, whether it is a policy shift, a housing initiative, a neighborhood program, or research. Together, we can, with climate action, equity, and well-being, into healthier, more resilient cities. Thank you.
Honorable mayors, distinguished guests, dear colleagues and friends. More than half of humanity lives in urban areas where health, environment, and the economy intersect, creating complex risks and unique opportunities. Urban areas are on the front line of many modern health challenges, including air pollution, climate change, pandemics, and persistent slums. Inequalities expose and exacerbate many of these challenges. Just a few weeks ago, WHO launched our new guide for decision makers on taking a strategic approach to urban health. This is the first comprehensive WHO framework to help governments design, coordinate, and implement cross-cutting strategies for urban health and health equity. Acting strategically allows us to align our decisions to build healthier and fairer futures, where urban systems work together to advance health, equity, sustainability, and resilience. We're grateful for the long-standing partnership with the International Society for Urban Health and are proud to be co-sponsoring this event. Together, we can create a safer, healthier and more resilient future for our cities and the people who call them home. I thank you.
Tēnā koutou, tēnā koutou, tēnā koutou katoa. Good morning, everyone, and a very warm welcome to this plenary on age-friendly environments and well-being. For those who don't know me, I'm Thiago Eric de Sá. I'm the responsible officer at WHO headquarters for this area of work, which includes the coordination of WHO's global network for age-friendly cities and communities. And I have to say that I was actually very happy to hear from Giselle, Philippa, and the ICUH team that one of the themes of the conference this year was precisely on age-friendly environments and well-being. Because, and this is, I'm sure, surprise to zero people in this room, we know that there are at least 3 major trends now shaping societies and shaping the health and well-being of all societies. One, as you heard already, is climate change and environmental degradation. The second is accelerated urbanization, or a fully urbanized process that already took place in many regions of the world. And the third one, which will be really the focus of this plenary, is on demographic change and population aging. Adding more lives to year is one of the most remarkable achievements of humankind. We should really celebrate the fact that we are living longer lives. Like we have succeeded to double global life expectancy in a bit more than a century. And this is truly remarkable. Now, on the other hand, those additional years are not necessarily lived in good health. And that is true for low and middle-income countries, but also for high-income countries. It's true all over the globe. So that is to say that we have succeeded in adding years to life. It is now time to add life to years. And that's precisely what drives the development of which I hope can be on the screen now. There we go. Of the United Nations Decade of Healthy Aging. We are halfway through the UN Decade of Healthy Aging, which is really this global concerted effort to ensure that we live not just longer, but also healthier, dignified lives. And ensuring that communities foster the abilities of older people, current and future generations of older people, and promote healthy aging across the life course is one of the key action areas of the decade. But this is not news to WHO, because since the publication of the WHO guide on age-friendly cities and communities, the one you see in blue up there back in 2007, and more recently, a guide to support member states developing their national programs for age-friendly cities and communities, we've seen that developing age-friendly cities and communities is a proven way to create those types of environments, of age-friendly environments, as they enable people to shape their communities according to what they have reason to value in life. So this has been demonstrated since 2010. Actually, the cities, communities that helped us create that framework asked WHO to create a platform where they could share and learn from one another. So this has been demonstrated over the years now, since 2010, at WHO's Global Network for Age-Friendly Cities and Communities, which now includes over 1,700 members from very large cities, Auckland, Paris, Manchester, São Paulo, Guadalajara, and many others, but also to small towns and rural communities, the smallest one having 200 inhabitants. Each of those orange dots that you see in this global map. Those members, they span across 60 countries, and they're all committed to become more age-friendly, and those are the countries that you see marked in light blue. And in 19 of those 60 countries, we already count with an age-friendly program affiliated to the global network, marked in dashed or dark blue in our global map. And their work is very much behind the success of this initiative. Now, I have to say that there's a lot of energy and action, of course, outside of the global network as well, and you'll hear from some of that in our plenary today. But to kickstart our conversation and unpack some of the efforts for creating age-friendly cities and communities, it is my great pleasure to introduce you to our keynote speaker, Diane Turner, formerly the director of the Office for Seniors in New Zealand until this year, and a key architect of the age-friendly Aotearoa New Zealand program. So Diane, the floor is yours.
Kia ora koutou. It's great to be here today, and one of my last actions before I left the Office for Seniors was to cement in the opportunity for us to present at this conference. So I really welcome the opportunity to do so. So just checking I can change the... Okay. So, in this presentation, I will focus on the work of the Office for Seniors in leading a national program to create age-friendly cities and communities across Aotearoa, New Zealand. The Office for Seniors Te Tari Kaumātua is a very small team of 10, of whom one has had the full-time role focused on a national program. We're located in part of one of the biggest ministries, the Ministry of Social Development, which has roughly 9,000 staff, based here in Wellington. The Ministry's wider role is to provide policy advice and deliver social services and assistance to young people, working age people, older people, families, whānau, communities, and improve the social wellbeing of New Zealand. The primary role of the Office for Seniors is to support our Minister for Seniors in the portfolio by advising on the rights and issues of older people, coordinating responses to an ageing population across government, leading and coordinating responses to population ageing by local councils and communities, raising awareness about issues experienced by older people, and to support the Minister in their advocacy role by providing them with a good understanding of the issues that older people experience. And I think we're very fortunate that we do have a Minister for Seniors, and equally fortunate that in the 9 years of my being in the office, that Minister sat round the cabinet table of the top 20 ministers or elected representatives, so they had a key seat around the table. So, you know, I have never taken that for granted. So in terms of the presentation, I'm going to use the World Health Organisation's guide that Tiago mentioned just now. Published in 2023, this valuable resource did not exist when we started the National Age-Friendly Journey, which was in the early stages of development in 2016 when I arrived at the office. I think it is important to see fostering health and wellbeing in older age as a partnership that we all have a role to play and work together on, whether we're government, local government, from academia or the research community, an NGO, community organisation, group, or even as a member of a whānau or an individual. The framework consists of 6 interrelated elements, and I'm going to touch briefly on a few of those in my presentation. I'm going to be time-kept because I'm likely to run out of time. And these elements fit within the model and principles and steps for creating age-friendly environments, which are engage and understand your community, plan strategically, age and implement and evaluate, and it's a continuous cycle. So just a few milestones. So age-friendly, although it's been around, you know, as a concept for a very long time, in New Zealand, the first council to adopt an age-friendly plan was Tauranga in 2013. And that was followed in 2018 with Hamilton becoming the first city to join the age-friendly network. At the same time, almost, that we as an office, through our role, were able to become an affiliate member. In 2019, we launched our strategy, which has provided a really good platform to help engage with communities and others on age-friendly. We also launched a grants program in 2018, which I'll speak a little bit more on shortly. And by the end of this year, we expect to have made around 90 grants valued at over $1 million, which is a lot of money for the Office for Seniors, I can assure you, but in the scheme of things, and government expenditure is very tiny. In 2021, we established a network, the Aotearoa Age Friendly New Zealand Network, which has now grown to 36 district and city members, mainly represented by local councils. This represents over half of all local councils in New Zealand and close to 80% of 65-year-olds in the country, which is largely thanks to Auckland becoming one of our early members. In 2023, we established an age-friendly employer network. The still small network has 11 members, including businesses across the sector, such as banks, trading stores such as Bunnings, a senior jobs search platform, the New Zealand Ambulance Service, as well as sector representatives such as Business New Zealand. All members have demonstrated a strong commitment to support their older workforce. The Office is looking how it can enhance and grow this network within our available resources, and this is one of our ongoing challenges. I think my team, and I still think of them as my team, are full of ideas, but they need to be measured against the resources that we have available, because the last thing you want to do is burn out your team. So turning to the framework and some of our initiatives, I'm going to talk briefly about partnerships, networking and stakeholders. So much of what creates a positive difference in everyday life happens at a local level, and especially through local councils and community organisations. And for me, this is one of the best aspects of the age-friendly movement, the ability to put tools and resources in the hands of communities to be able to drive change. Our approach to local government has been one of support and encourage, and I think that has been driven by my experience as being involved, part of the local government sector, and watching so often central government, I guess, sending messages or dictates down to local government. So yeah, it's one of support and courage. And this is partly because there's nothing compulsory about our program, and outside the very small grants program, we don't have a funding carrot or legislative mandate that exists in some of the other jurisdictions around the world. Engagement continues to be an important component of building relationships across local government and with other organisations. As being part of government is also an opportunity that we have that's not available in all jurisdictions, and I've got to say it's not without its challenge, because you know, as with a lot of jurisdictions, most of the government focuses on things such as the economy, education, youth employment, and more importantly, reducing the cost to our economy of ageing without appreciating the inputs and benefits that older people bring to our population. So I've been advised that I'm running out of time quickly, so I'm now going to move on. So I won't dwell on the strategy, but I would encourage you to look at it if you're interested in such things, but it's actually provided a momentum and a framework for us to move along together. We've had a second action plan to support the implementation of this strategy will be launched by the Minister later this month. So some of the key things that we have done to support local councils has been around providing resources and support largely available through our website, how to get started, what to do, what information is required. We've also developed up a small package of case studies and success stories which we share through our website and our communications with both our stakeholders and the wider community. I've mentioned the grant program, which I was originally sceptical sceptical about, because the maximum grant available is $15,000, but actually it's amazing what difference a little amount of money makes. And I describe it often as the pebble in the pool. So it has been very successful. We recently had it evaluated and independently evaluated with some recommendations. Again, that is on the website. So because I'm speaking to a lot of academics, I think my last message is that we've worked hard to build up relationships with researchers and academics, because they contribute so much to our work. And there are a number of things that we've done to build up that relationship. We've contributed money to conferences, small grants for discrete research projects. To our benefit, we have contracted tertiary institutions to complete research projects, which is a very cost-effective way of getting important research done, and it provides opportunities for students and postdocs to gain valuable experience. We provide letters of support, accept invitations to be members of steering groups for work, sharing and promoting research findings, because often it's that actually how do we turn our research and our findings into actions. And also connecting researchers with policy makers. And the last thing that I would mention, we're also looking for opportunities for academics to be hosted by the office or the department in their sabbaticals. So that's another opportunity. So I will skip monitoring and evaluation, but we do monitor and evaluate our work. So we're monitoring some indicators, and we publish all our evaluations, and there are a wide range of evaluation techniques used in the office. So that's a very once over lightly. Age-friendly is a journey, it's not a destination, and I know that's a bit of a trite thing to say, but it's something that we must continue to work on. It relies, as a model, it relies on building strong relationships across different sectors and supporting communities to forge their own paths. Resourcing will always be a challenge, and one that we just need to accept. However, I think that until we're able to combat age-based stereotypes, prejudice and discrimination, older people will struggle to be heard and to be respected and valued for their contribution, and as such, we will not become truly age-friendly. Thank you.
Thank you so much, Diane. And as you saw, colleagues, now the work of a national program for age-friendly cities and communities is really to foster the ability of communities towards their journey for becoming more age-friendly. And as you saw on Diane's last slide, it's not just about accessibility, it's not just about social inclusion. There are at least 8 domains where we should intervene, and oftentimes cities, communities, they add some more. So it's really not trying to have a 360 look on what needs to be done with all the people at the center, with the support of programs such as the one that Diane led for the country, just so that they can do the work on the ground. And we will now hear, while I invite my distinguished panelists to join us, we will hear from one example at a community in New Zealand, which really illustrates how this holistic, people-centered environment can enhance well-being across cultural and policy contexts. They could not join us today, Rangi Mahora Reddy and Yvonne Wilson, but they have kindly shared a video on the whanau-centered models in housing and social enterprise for healthy aging that we're going to play in a minute.
Kia ora koutou katoa, kanui te mihi. My name is Rangi Mahora Reddy, privileged to be the CEO of Awako Mata Charitable Trust, and extremely happy to be here presenting on the age-friendly environments and wellbeing for the International Conference of Urban Health. Kia ora.
Ko Yvonne Wilson ahau, ko rangi tū mai te maunga, ko Ruamangana te awa, ko Kahanune ki Wairapa. I'm the Strategic Relationships Housing Manager for Te Rūngango Kirikiriroa. The first slide that we're going to show you today is around Māori-led kaumātua-driven innovation. Our kaumātua have been instrumental in driving a lot of the work that's come from the runanga, from the awa, and in design, and also their strategic thinking and vision. The integrated age-friendly ecosystems actually embedded in the way we work together. And below, in the photo below, you'll see a couple of karawa who are using their designed cookie cutters, and this has helped be able to support the work of awa. So very innovative our kaumātua are. The next slide is around housing, and we've been working collaboratively with the University of Waikato, the Awa and the Runanga in developing a housing toolkit. So all the learnings, lessons learned from design and build, we've been able to put together and share nationally and internationally. Our thinking and our way of working is intergenerational modelling, urban puppet kind of design models where care and attention to tenancy management and support is paramount. Also, the main aim is to prevent any of our older people becoming homeless.
Te Whānau Te Ora is another age-friendly initiative that we're undertaking, and we're privileged at Awa to have this as our site, and that opened in 1941, so the image up the top showcases when it was actually opened, and today, 84 years later, it's got a sweet connection to serving kaumātua that are of its own age or older. And that at the moment we're undertaking a Dimension Age-friendly redevelopment on the site. Our wish is that we finish stage 3, or we commence stage 3, sorry, in 2026, and stage 3 is the final stage to finish its transformation. A key part of that transformation is digital inclusion. So the creation of a digital wellbeing hub is part of this updating of the facility, so that we can incorporate tools that will enable the wellbeing of our kaumātua, such as you can see Tukuia there playing an online game, and that was developed by Awa. It's called He Maumahara, and it's basically a matching game, and that as well as incorporating live streaming. So in the image next door you can see this is an image of the opening of stage 2 that took place last year, and up on screen are residents from Bupa. So we were showcasing the live streaming technology by showing what we would be able to do if we're supported to complete our kaumātua vision for the facility itself and create that digital wellbeing hub. Our approach to inspiring change and supporting age-friendly environments is for all of the things that we do in and around our community. It's about people first. It's about what they envisage. It's what their dreams and their aspirations and what their needs inform. It's also heavily culturally informed in terms of design. And ensuring that we connect across the generations is really important, so that there's that consistency and flow and commitment to continuous development. But at the heart of it all is about community-led transformation. And so as we continue to innovate with Awa and the Runanga, we hope to keep sharing what we do, and I hope that others might take it up, make it their own, make it better, make it stronger, so that we can then learn from them as well. And it's all about making starts, doing your best effort, and hoping that others might build on that effort, so that you can continue to grow in terms of kaumātua wellbeing. So we hope that you enjoyed our contribution to the panel, and I'm sure Tiago the speakers that are about to follow, and Tiago will do a wonderful job of inspiring you all more. And so thank you for the opportunity.
Thank you.
Thank you so much, Rangimahara Yvonne. It's actually them that inspire us on a daily basis. And we try to bring as many different initiatives as possible. Right? And so the idea now is that we really zoom into one of the domains that Diane has just presented. And for that, I would like to welcome our dear colleague, Dr. Pauliazi Tony Whakahau, that is going to share some insights on developing aged care in Tonga. So, Tony, you can either take the podium. I think it's easier.
Kia ora tātou. Nō like to first acknowledge everyone that's here and Tiago and the panelists, and also one of my senior colleagues from Tonga is here, Dr. Rami Tuoka, also helping with my PhD. It's an honour to be here. So I think I'll be 5 or 10 minutes, but this project, this particular program that we've got, is a bit different, and it's basically came out from a project that the Asian Development Bank undertook in 2017, and our organisation were part of the group that went in and started this. And it basically is to try and develop the aged care sector in the Kingdom of Tonga. There's my mum and my auntie. They were part of the research team, and it was really important because as a New Zealand raised Tongan, it was important to connect, and I took a lot of my advice and my team from my elders back home. So basically, in terms of Tonga, what the Asian Development Bank did at the time was quite a new thing. They wanted to make sure that at least the Pacific is starting to move down that track and start to prepare the aged care sector. And in Tonga, at the time, they had a policy of providing a social welfare payment, which was the trigger for the Asian Development Bank to step in and help to develop the sector wide. So at the start, these are the things that we found there was a problem. There's a growing need for aged care. There was insufficient care, obviously, because it hasn't been developed. It still relied on traditional methods. One of the big problems is migration, and able-bodied family members coming to Australia, New Zealand, America, obviously will leave the elderly, the elders vulnerable. So these were the key things that that we found there were issues in Tonga, and what we needed to do. But also one key thing there was also important to make sure that, along with aged care, is dementia. How we treat dementia in Tonga was it was a new thing for some of them, even though it's there, but just trying to work through it, help the community to understand, and the families. Now, what we did find is that when we talk about vulnerability, especially with climate change, urban areas did get the support, which was fine. Access to support was quite good. However, when you talk about the islands, you got to remember that it's quite a vast, and there's over 100 islands, and there's probably about 20 or 30 of them where there are people, and many of them, the older people there, when there's issues around with natural disasters and so forth, they become the most vulnerable. So just imagine if there's a cyclone coming, how are we going to support, the most vulnerable people? So those are issues and challenges that Tonga and the rest of the Pacific have to deal with. Now, obviously these are things that you know, why it's vulnerable, you know, why climate change is playing a big part in the Pacific. Now, for some of you that would say that, look, the easiest thing would be is to get those older folk from the outlying islands into the urban areas, but it doesn't really work that way. For them, you know, the land is their blood, this is their history, this is where they're from. So climate change, you know, it does play a massive part, and we're starting to see it in Tonga. And it is one of the main issues and challenges that we continue to face. Now, we'll go into the main part now, because I only have about 3 minutes to go. So now, to start to develop a sector, you've got to pretty much start from ground up. And the main things there are, you've got to have to try and make sure that you integrate the whole system, bring aged care in with everything, transportation, health, education, all the way over, you know, all the way through to training healthcare workers. All right, making sure that it's integrated. The other issue you've got is policy frameworks for the Pacific. Policy changes in terms of governments that, you know, Tonga at the time, they were going through different, you know, they had a new government coming in every 3 years, and that doesn't help. So it's trying to knuckle down the policy framework to drive this body of work through. And obviously the legal framework. Another key issue is that we must ensure that the legal protections are there, and that they're there not only to protect, but most importantly, to protect the older generation and the older folk, but also make sure that those that are looking after them have also the qualifications and are trained appropriately. Infrastructure, service quality standards. I see the Inter-RAI, you know, was up just before in Diane, and those are things that Tonga needs, just like every other Pacific nation. And workforce training, not just for the caregivers, for families, but also those are in the sector. You know, my last minute here, I just want to say this. When countries like New Zealand and Australia develop things like RSE, and you want the able-bodied people, you know, you got to remember what you're going to do back home. Who stays back to look after the most vulnerable? As well as we're training healthcare workers, caregivers in Tonga, but you're going to end up taking them back, bringing them over to Australia and New Zealand. You got to think about what do we do for those back home. Anyway, look, I think I've pretty much run out of time, but I'll leave it to the rest of my colleagues. Thank you.
Thank you very much, Tony. This is a very, very compelling, interesting example of a challenge on how to develop a sector from scratch with all the people at the center. So thank you very much, Tony. We now have a different angle. Now we go for a city that is aging rapidly, that is urbanizing rapidly. So for that, I would like to have Natasha Berkowitz, who is with the city of Cape Town, and she will present on the age-friendly considerations that Cape Town is taking under their city's urban health approach. Natasha.
Kia ora. Thank you so much for giving me this opportunity to present some of our work from the city of Cape Town. We, as Tiago mentioned, this is a slightly left of field compared to the rest of the presentations, as I'm going to share the journey that the city of Cape Town is potentially on with becoming more age-friendly and using our urban health program as a vehicle for that work. I'm a public health medicine specialist. I work in local government, in the city health department. Traditionally, we've been more of a department offering services, both primary healthcare through a network of clinics, and environmental health, environmental inspections. But now we're shifting more into a strategic public health guidance role, where we're implementing a program that hopes to develop our health and all policy strategy for the whole city. So to introduce you to Cape Town, I'm sure this is what, when you think of Cape Town, what you see and in your head, and I hope many of you come and visit us. Similar to Wellington, you have beautiful oceans, green spaces, access to the nature reserve in the middle of our city. But in reality, this is just for the privileged few. We are a city and a nation of huge inequity. A majority of our population live in slums, as you can see on the left of the screen there, with just a minority living in acceptable conditions, as you see in the Sea Point area there. And so highlighting this, that age sensitivity is an equity issue, ultimately, and equity is part of which drives our whole initiative. As Tiago mentioned, our city is rapidly urbanizing, it's growing. We're just under 5 million people, so consider just one of our suburbs is the size of Wellington. We have a population that is aging. You can see from our population pyramids there, as well as the increasing dependency ratio for older persons. And so obviously with these issues with this demographic change, come specific strategic issues that we need to address as part of service delivery within our city. Additionally, our aging populations are densely located in regions within the city that are lower income. So that's just looking at the population density, and the darker areas correlate to our lower income areas as well. So that's with how we deliver our services, we need to consider how we deliver to the most vulnerable in our communities. So as I mentioned, one of the strategies that we are employing is the development of our urban health program. And this is a vehicle with a vision to create a platform to ensure that there's health in all policies. All of our departments across the city, service delivery departments, consider the impact that they have on the determinants of health within our city, and ultimately using key priority areas which we've identified due to the burden of disease as well as feasibility to address these determinants, and then looking at the impact through data and evidence of these initiatives. And we've chosen 3 priority areas. I think these priority areas are similar to much of the work that colleagues are doing across this platform. And I'm not going to go into detail of those. You can come to my oral presentation tomorrow if you want to hear more about our governance journey. Just giving an advert there. But one of the principles of the program is both a gendered and a life course awareness and approach across all the interventions. So of course, age considerations and age sensitivity falls under the concept of a life course approach. So all these interventions will look at how we can include age sensitivity in the implementation. So I'm speaking towards the future, but the city already has a number of initiatives that speak towards age sensitivity. So I come from a directorate which is called Community Services and Health, and just within our directorate there are a number of initiatives that are underway that address age awareness. A nickname for our department, our directorate, is From Cradle to Grave, because we service the population from birth until death. So some of these initiatives include at our primary healthcare facilities, ensuring healthcare provision and screening for older persons. Our primary healthcare facilities are located in largely vulnerable areas servicing the lower income regions. Our libraries have created programs and specific safe spaces and intellectually stimulating programs for older persons to attend. We have active senior programs across 48 community centres. And then in other departments, in spatial planning, we have universal access requirements, which is actually legislated, and then also looking at how we support age friendliness in our integrated transport system. And there's a variety of interventions in that space. So just to wrap up, whilst we have a number of initiatives, we have areas of improvements and areas where we can expand. What we've noticed through our urban health work is that there's a lack of continuous age-sensitive specific design in our strategy. So hopefully that our urban health program will provide that strategic direction to other departments. We've noted that if a concept is legislated or regulated or mandated, it's much easier to enforce. And so how can we change policy towards more age-friendly design? We need better monitoring and evaluation, and I think we all agree with that in the academic space. But also the recognition that small decisions can have a big impact. And just an example, we unfortunately, another department cancelled a service called Dial-A-Ride, which provided free transport for persons with physical impairments, many of whom are older. And they just shut that down with no warning, and didn't quite realize the major impact that would have on communities going forward. And then finally, I think the one thing that I want to take forward and that we've learned from the examples across the past couple of days is to improve community involvement in strategic planning and implementation, specifically with our age-friendly initiatives. Thank you.
Thank you very much. Thank you very much, Natasha. As you see, it's not a silver bullet. It's not a simple task, and that's what cities are now being confronted. And I'm very pleased to see that Cape Town is already adding an age-friendly lens to whatever it does, because if cities don't do that now, they really miss an opportunity. So thank you very much, Natasha. Well, last but not least, we will hear from our dear colleague, Associate Professor Eni Kiota. She's an environmental gerontologist, designer, founder of IBASHO, and she will explore some of the community-driven infrastructure and intergenerational inclusion. Eni, please.
Thank you. Thank you so much for the opportunity to be able to share my passion actually about these issues. So I will start with little quotes that I found in Bhutan actually. It's supposed to be the happiest country in the world. So it says, the time to be happy is now. The place to be happy is here. The way to be happy is to make other people happy. I found this quote in an elementary school in Bhutan when I was working on a senior housing project for retired monks. This quote resonated with me because it captures the gap between our current approach of care and what older people want. Everyone wants to be useful to others, regardless of their age, physical and cognitive abilities. I have started to develop a model called IBASHO. The term of itself, IBASHO, is a Japanese term. It is a place where you feel at home being yourself. I took this, the word, intentionally to avoid this negative connotation of aging care, because based on my experience working with community members, yes, they are vulnerable at the time of disaster, but they have so much wisdom to share, and they have experience to shine. So I started this initiative and just try to give opportunity for older people to feel good about themselves by helping others. This IBASHO approach recognizes older person as a valuable asset to their communities through empowering them to be change agents themselves who challenge the prevalent narrative of aging and social role of older person. Older adults are increasingly being marginalized in the world, although their numbers are growing. For too far often, aging is viewed as simply a decline. Maybe I shouldn't read this. Aging is viewed as simply as a process of decline, the growth that accompany aging invisible to society. As a result, older people are effectively cut off from the society and the community and the flow of daily life in many cases. And the wisdom and perspective that they have can get lost to the children and younger generation in their community. So what we try to do through IBASHO is to challenge prevalent and mostly negative perception about older people through creating a program and a place where they can always feel comfortable and they can find an opportunity to contribute to others. And this photo actually shows what we have to do to think differently. So through the Ibasho's work, we work with community older people at post-disaster area. One was in Japan after the tsunami happened. This community was more than 10% of people had died because of the natural disaster. And also we worked with Philippines after Yolanda and Nepal after the earthquake happened. What normally we do, we rush into the disaster area, try to help older person. What we found out when we are talking to the older people and simply ask what we want to do. And there was one conversation I had, 85 years old lady. She said, I am very grateful that I have food to eat, I have a place to stay because I have temporary housing, and I have a clothes to wear. But Amy, it's been 11 months of being receivers, and what I want you to help me is to give me opportunity to do something. To me, that really hit me in the core with what we tried to do. And this photo actually was taken after we created this Ibasho project and the place in the program. The American Nursing Association gave us a little bit of money to create opportunity for people to exercise. So the exercise bar was designed for teenagers to exercise. And the bench that's next to it was designed for older people to sit around. What happened is that the people who exercise are the older people, and the children, the group of children actually play video game at the bench. This is kind of funny, yet this is actually a reality, but our social policy hasn't really caught up with this. So I wanted to bring this up today so that you can actually start to see differently who you are serving, who you're working with. We created this principle-based Ibasho approach, which was developed to challenge our social perceptions that older people are not only vulnerable, but they can actually be a part of solution. We don't have enough workforce. We don't have a lot of resources because we have more older population. What can we do? We want to include older people to create a place. And what we've learned so far, if you give them a blank sheet of paper and say, here, you do this, it is very difficult. So we created 8 principles with older people. This is the place where they would like to go to. So these are the 3 places. The one in the left is Japan, and the middle one is Philippines, and the right one is Nepal. I wanted to show these photos because a lot of time people say only Japan can do. But you know, the place can be anything. It could be different budget. It's just what's important is the community members' involvement. So moving forward, I have been teaching architecture, and so we just try to create the place to protect the older person, provide special service for older population, offer specially designed service and built environment, ensure age-specific designs there, and provide convenience through technologies. But if you're not careful, that creates dependency and ageism, stigma, segregation, and social isolations. I really hope that moving forward, we're not going to go into one direction extreme, but really try to keep it in between by working with older population. So doing in the Ibasho work, I was able to create 5 different places, the place where older people would like to go to, they run themselves. And I realized 15 years later, I am still making shinier, nicer box where people don't want to go at the end of the day if they can avoid it. And I think about what makes you feel like you want to go to. To me, it's a tree. I was able to work in Africa, US, Asia, throughout Asia, in many countries. It's always community have a significant tree, older people sit around, and older men actually looks after to take care of them. This is in Nepal, this is Hawaii, and this is, when I go to Hawaii, this is where I study. So I would like to, so I realized that, maybe we have to think from creating a space where people go to find a place where they are, and what can we do to create a better place. So I would like to end with my question, where's your mango tree? And what can we learn from it, and how can we actually change together? Thank you so much.
Thank you so much, Amy. It's always a pleasure to hear Amy talk. So, colleagues, we've talked about creating national ecosystems to support communities' agency, just so that they can reinvent their environments. We've talked about developing a person-centered care sector, starting with family. We've talked about adding an age-friendly lens to urban policies, whether it's transport, housing, education, employment. We've talked about being disruptive and addressing major challenges such as ageism, social isolation, which, by the way, affects both older and younger generations. We haven't spoken much about disease prevention and cities, but just throwing that out there for you to pay close attention to it. Now, I would like to start our discussion, but and I have a bunch of questions here. But I think it would be way more interesting if we could exchange with you, with the audience. And Giselle has kindly agreed for us to claim back the minutes from my boss's video. So we have about 15 to 20 minutes for an interactive discussion. So I would like to ask whether the audience has any questions to any of our distinguished panelists. Please just raise your hand. And if not, okay, we have a hand. We have two hands. So I was about to get my questions out. Melanie, please.
Thank you so much, everyone. It was wonderful to hear from each of you. I'm going to ask you a different type of question. I'd like you to reflect on maybe why this area is of personal interest to you. Why your personal commitment to age-friendliness?
Would anybody like to start?
Shall I start? I guess because when I started it was going to be me, and now it is me. And so I always remember when I first started my job, in the first week I arrived, Dame Peggy, who's probably New Zealand's grandmother of gerontology, who recently passed away, announced that she was going to visit me in the office. Now, I was really scared about this because those of you who knew her, she's a formidable woman. And really, when I started my job, there wasn't much I knew about older people other than having, parents and grandparents. So I thought about how I was going to approach this. So I said to Dame Peggy, I said, well, I think I have some skills and experiences that can add value to this role, but I know that I've got a lot to learn about older people. So I've spent the last 9 years learning about the issues and interests of older people, and applying the skills that I've learned and developed over a career to contribute to the sector. So now that it's me, I do want to make a difference and continue to make a difference for older people. And Dame Peggy and I became the firmest of friends, and she's a mentor that I deeply miss.
So I'm a clinician by training, an MD. I started off working in primary healthcare clinics in one of our informal settlements, and that's actually what sparked my interest in public health. I recall sitting one-on-one with patients and thinking I can make a difference to one person, but how do I make a difference to a population? And so I ensured that the community became my patient. And through that experience, the people you see at the facilities, many of them are older persons, but not only older persons because they are unwell, but because they are caring for the community. Their daughters and sons are out working. And so this specific topic in my passion for creating a healthier urban environment is to ensure that we do not forget those caregivers that are the bedrock of so many of our communities, and that we create spaces in Cape Town, which has many challenges, that are friendly to them, and as an African city, how we can adapt the different strategies that my colleagues have shared into our local context, which I think is a gap that is missing. So yeah.
For me, it is extremely personal. I went to, very first time I went to nursing home was to visit my grandmother. To me, she was a hero for me. She was a very strong woman, sent me through the university and helped me through the university. But when I saw her in nursing home, she was 14B, was called bed number. And no one knew her first name, but everybody knew about my grandmother's room number and health status and what they eat, which was very, very strange. And I thought, I'm just gonna have to do something. I was too young to know the reality of it. And I thought, I'm just gonna quit my job and just study about this. Because to me, I'm not a clinician, I was not a social worker, just layperson, young one. It was very simply strange that, when I see my grandmother's eyes, I see the spirit. She has dementia, but I see the spirit, but no one else was able to see. So I just wanted to do something within what I could do. That's how it started.
For me, I'm a trained economist, and I'm an economist, but when you, for a country, to work out how you've done, how well you've done is GDP, so how much do we make, and etc. And I presented at a conference years ago, about 15 years ago. One of the people who was there was Dame Marilyn Warren, and for those that don't know, she's one of the most famous women in the world who looked at unpaid work. And for me, she told me to look into that area, because how I used to do as an economist, when you work out how you're doing well, how many ships have we got? You count them, you work it out, and that's what you call fixed capital formation. She told me about unpaid work and how important it was. So my research was around the most vulnerable. And during that, provided me the opportunity to go right down to grassroots, visit the islands, and see and work out who are the most vulnerable. And that's what I came across. Obviously, it's the older persons in the Pacific.
Thank you, Tony. It's interesting. This is it's a common story. It's quite rewarding to work for your people and for yourself as well. It's the only work where you have a personal interest in it. And what Tony mentioned is quite interesting. I have a colleague, Peter Rundlet, from the American Association of Retirees and Pensioners, the AARP, and he keeps saying that the aging is a development issue. So it's an opportunity not to miss. We have another question from the gentleman there.
Hello. Thank you for the presentations before. My question is quite a practical one, I hope, which is about how we look at retirement communities in countries like New Zealand, not necessarily New Zealand, but I'm thinking of the commercial model that we tend to have adopted in New Zealand, where people go into they pay money to go into a retirement community, and I suspect there's sometimes a degree of fear around, how they'll survive outside the community and what sort of medical support they'll have and all those things. But I'm just struck by the contrast between the retirement community concept and the aspiration, if you like, to remain connected intergenerationally and to your community in a broader sense, whereas retirement communities seem to be isolating people, if anything. So perhaps you could comment on the model there and whether you see it as beneficial or partly problematic, or have we got it right?
So I can comment on this. So I think one has to look at the marketing of retirement villages as an option, and it's marketed in such a way that there are a whole lot of older people who think that they're not getting what's owed to them if they can't live in a retirement village, because it's marketed with all these facilities, the perception that you'll be safer. It's also marketed to their children that will take your problem off your hands. So, you're starting from that sort of base. And don't get me wrong, there's plenty of people in retirement villages that are very happy there. But for me, I always say that I value having friendships across all generations, and I hope that I'm able to continue to make friendships with younger people and older people and people of all ages. And age-friendly, I think one of the founding principles is to enable you to have a rich life in your community. And that community could be a retirement village, which can sometimes be problematic because often they want to enclose you and they'll put you on the edge of a city where there's no public transport, so it becomes problematic to have that engagement. But equally there are retirement village models where the community also comes in. So we certainly in the office encourage the sector to be thinking about how they can remain engaged in communities. So I think it's symptomatic of our culture, sort of white middle class, where we need to shut people away and take problems off hands, when what we're really trying to do is that no matter what your age is along the life course, you have a role to contribute to society, and we need to have communities where you feel safe, listened to, and able to contribute. And hopefully by adopting an age-friendly approach, that will contribute to feeling that way, rather than feeling that you're missing out because you're not living in a retirement village.
And this idea of self-sufficiency, autonomy, independence, that is actually pushing us towards social isolation and loneliness, and that gets embedded in architecture and how we plan cities, communities, there's all of that. Natasha, Amy, Tony, would you like to comment on that particular question?
I think from a Cape Town and African perspective, the retirement villages are prevalent in our high-income populations, and so I think it would be an equivalent discussion to what you've just shared. But where we don't have the resources for these communities is where we need to develop the resources to care for older persons in community. And unfortunately, I think what we're seeing a lot in our more informal areas is that there are older persons living alone, or they are left in their children move to cities and they are left in more rural communities alone. And so how do we adapt our policy, adapt our environments to support these individuals as a community, is a question that we need to consider and ask ourselves.
So for me, so I think that dichotomy between home retirement community needs to really be reconceptualized. That's why we are just, this part of Ibasho is to try to fit in so that people, majority of people would like to stay at home, right? To support them, normally we only focus on home or institution, but there's nothing in the middle. I do personally think we need more options. And I think institutional care has its own role to play, but it doesn't, that shouldn't be the only alternative. So we need affordable housing issues, a part of the elder care, and nursing home has its own place, but I think we have too many people in nursing home who don't need to be in nursing home to begin with. Need to be coordinated with hospital, the housing authorities. So at the end of the day, we need more options for people to go to. And I think also, interestingly, the concept of ageism play a role here. I think people has this idea that older people have to go to certain housing. And that has to change, because I think ageism is an interesting ism. So sexism, racism, you are discriminating against someone. Ageism, if you're discriminating someone at this moment, it'll be you, because we all age. And I think we really have to start to think that way. It's really our issues in the future.
Yeah, I think for times, what we found was pretty interesting, that the older persons didn't want to go to a rest home. So the model we have here, you can't take over there. What they did ask for is, can we help their families with a respite centre? So their model is, in every 10 or so villages, there'll be a respite centre where their families, where they can spend a day to give their family caregivers a break. And then, but one of the things they did say is this: don't ever take us away from our families, because we want to talk to them, we want to talk to the young ones and so forth. They always want to be with their families, but they just need some help. So that's the fixable model that they, yeah. Thank you.
What I find quite interesting about this work is that we're really reinventing societies in every single sector, our needs, aspirations, and there's a lot of innovation, experimentation on how to do these things that the colleagues have just mentioned. Caring communities, aging in place, more intergenerational designs for people to live together, whether they have dementia or not, or physical impairment. There's a lot of, I think, untapped opportunities when it comes to indigenous knowledge as well. We've just learned from Emi Basho. Can we learn something from the whānau concepts that we have in New Zealand? Can we harvest on that and maybe recreate our cities, our communities in a way that it's fostering healthy aging? I'm afraid we have time for one more question. We have 4 hands raised. So how should I do this? I think I'm gonna give the floor to the person that held the hand for longest. So please.
Hello.
Yes.
Thank you everyone for your presentations, excellent and inspiring. I do have a question for Dr. Koliasi. You shared with us the results from your research with a very strong research team, Mama and Auntie. That was very impressive. But you talked about the pathway to developing aged care sector. So what are the next steps of your research, especially for other small nation countries who might be looking into applying something like that?
The other part of the presentation I put up was that's now implementation of the model they wanted to move forward with was based on the research, and the model was the respite centres. The sector, or the families and the older persons sector, wanted just the respite centres but placed strategically, and they put it in areas, 4 areas, that if there's a natural disaster, they can quickly get them there and their families. So those, it goes hand in hand with the climate change. So with the research, It's just making sure that you go all the way. But of course, it requires funding. And Tonga has been quite fortunate that the Asian Development Bank is funding that. The rest of the Pacific, I'm not sure. I think Tonga is like a model. And if it does work in Tonga, and I'm sure it will work, I think for the next 5 years is when they're going to complete that part. Then they'll look at the rest of the Pacific. Yeah.
Super. Thank you to our keynote, our outstanding panelists, and to you all for the engagement. I really hope that you can carry some of these ideas into your work. Now you know where to find us, and let's continue to help creating cities, communities where everyone can live longer and healthier lives. Thank you so much.